Welcome to Health Matters with Lynn Szabo, our resident PA. Are you a PA or PAC?
I'm actually a PAC. There are no just regular PAs. You can't bill unless you're certified, and that's like taking the bar exam every 6 or 7 years, 10 years now. So
Wow.
I'm a certified PA.
Okay.
Yeah.
All right. What are we going to talk about today?
Endometriosis, this was interesting actually. Well, they're all interesting. Medicine is fascinating, but endometriosis is considered a chronic inflammatory disease where endometrial tissue, which is the tissue that's in the uterus that becomes menstrual blood, kind of gets misplaced and it's not inside the uterus, it's just kind of randomly outside of the uterus. And it's a very, very painful problem and also a super big deal with infertility.
So just like a vagabond that decided to get up and leave?
Yeah, for some reason, probably a number of different things happen, and we'll talk about that. But so when women, it does a couple of things. One is when women are menstrual, it's like you're menstruating inside on the surface of your bladder or on your intestines
Ouch.
in a sterile peritoneal cavity. So there's nowhere for the blood to go. And then
So where does it go? It just stays there?
there's special cells that are supposed to clean it up, and sometimes they don't do a great job. Um, so also it can cause scarring and adhesions, and that becomes painful for people too. Adhesions are like they look like little spider webs, and they kind of hold organs to each other in an unnatural way. Because as an aside, if you think about it, in the inside of the abdominal cavity, intestines have to move, especially small intestines. We feel that when our bowels are gurgling.
Okay.
Okay, that's movement. There's a peristalsis movement, so that keeps everything moving from the mouth to the other end. And the uterus actually itself is kind of like a washcloth on a clothesline, where it's got a couple of anchoring points, and then for the most part, it's made to kind of move around. So it moves during pregnancy, it moves during menstrual flow, it moves during sex, it moves when you have to have a bowel movement or empty your bladder. So it's kind of
So just
really
doing a little
cool.
dance in there all the time.
Yeah. So, but this kind of tacks it down a little bit, and it's really, really painful. And it's really hard to diagnose. I think women would be surprised by that. But an experienced clinician can have a good clinical idea if somebody has it. But it's the diagnosis is made only by direct visualization, which used to mean kind of major abdominal pelvic surgery, and now it means it can be evaluated laparoscopically, where a couple of incisions are made, and a camera is kind of put in, and you just kind of look around and biopsy what looks like it needs to be biopsied. But about 10% of women of reproductive age have this, which I think it's higher, actually.
I know several women
Right.
who say that they
I
have
think it's
this.
way more than 10%. And they're talking about reproductive age. It's usually diagnosed between ages 18 or 29, but this blew my mind. A woman who is premenarche, so before she started, I don't even know if they could call a woman, a young, girl maybe, before her periods can have it.
You're kidding.
And postmenopausal women can have it. So even though it's hormonally driven a lot, that's not 100% of the story.
Wow. Is that because it's inflammation and you can get inflammation at any age?
Yeah.
Jeez.
And then of course there's the problem with movement.
So,
Stuff can't move like it's supposed to.
so there's the potential that little girls before they start their period are having this issue. So when they
Mhm.
have their tummy aches, that's what this could be.
It could be.
Gosh. How
Yeah.
would you know?
I I didn't even know that was a possibility. And now I'm looking at some of the young women I see that talk to me about abdominal pain, and I'm beginning to wonder.
So when we diagnose a little girl with having anxiety and all of these other things because she gets tummy aches frequently,
Yeah, anxiety is not the correct diagnosis for we don't really know what's causing it. But that's the
jeez.
one that gets put on people.
Wow.
It's also likely there's a genetic link. So part of it is genetic. So anybody with a first degree relative, so that means an immediate family member that has it, it's
So like
not
your mom, grandma, sisters.
right. Daughter, that's appropriate. It's not like your second cousin. So you don't need to tell the provider about that. It's immediate family.
Okay.
And it's seen mostly in white women with lower body mass index. So thinner white women.
Wow.
It's kind of interesting.
Does it go away if you gain weight? Because I'll eat more cookies. I don't mind.
Yeah, that's a no, it doesn't.
Darn it.
No, I think actually it could be worse because then things don't have as much freedom of movement for other reasons. But what they think, besides the genetic thing, what they think happens, and this is wild, is what's called retrograde menstruation. That means periods that go upstream instead of out through the vagina. So
How
the menstrual blood is, most of it goes out through the vagina. And we're familiar with that. But retrograde menstruation means the blood goes up through the fallopian tubes, floats out of the end of the fallopian tube and kind of in the area where the ovaries, intestines, bladder, et cetera, are.
how would that even that doesn't I mean like
How is that a thing?
yeah, like I'm trying to picture this how that would work. Like but there's gravity. Is that how it comes out to begin with?
I don't know.
What
Maybe
pushes it back up?
maybe you're lying down and it just kind of floats out the other direction.
So don't sleep upside down when you're on your period.
I guess. But get this. This is what's really wild. 90% of reproductive menstruating women have a flow of blood that goes backwards at
Wow.
any one time.
So it is just a thing.
So it's a thing. But that's where those little cleaners come in. They're supposed to be cells that kind of tidy that up. And what they think is to some extent those cells are slacking.
So we just need to make more of those. How do we get more of those cells, or how do we make them engaged to do their job?
I think sleeping on a slight angle might be as complicated as the answer that we have right now. Um, so that kind of blew my mind. I always learn something. It also spreads in the vascular system and the lymph system. So the lymphatic system is like that tissue juice stuff you can squeeze out of a scrape. Well, the reason that that's around is it carries like things that help with infection, fight infection to the lymph nodes. And then the lymph nodes are kind of like where the concern about infection gathers and then is put to rest.
Okay.
Okay, so it's like a filter
Wait,
system.
so you're saying endocrine tissue gets into there?
See,
Are you,
I know this
right?
is wild, huh?
My mind is just
I know.
racing with trying to figure out how this works with what I know about anatomy. I don't get it. What?
So some errant endometrial cells go through the lymph system and also the blood flow. They just kind of end up and they're because they're not cleaned up properly at the site where they're supposed to be hanging out. And they end up in places like lungs. I know, mind blown.
But that would mean that because your blood goes everywhere. So is it growing on
Right.
your brain?
It
Are
could
you
be.
getting migraines from this? Like,
No, I don't think you'd be getting migraines from it, but somebody had a lung disease. So it's going to end up mostly where the lymphatics and the blood flow is like in really fine vessels. So not like your aorta, the biggest artery in your body. It's going to end up where the tissue, where the where the what's flowing through there is basically on a enough of an aisle width for a single cell. And then it gets caught in that because it's a really fine net. So what they said in my resources that they found endometrial tissue and lung tissue, and that makes sense. So
no,
because
it doesn't.
that's a really fine filter. So in order to get oxygen out of the air, it has to go deep in the lungs and is in a part of the alveolar sacs that are pretty much molecule to molecule things are happening. So it kind of clogs that system. Really interesting.
Wow, really horrifying. I like your
I
interesting part.
know
It's
how to
better, but
survive all this. So, and it's also associated with uterine anatomic variants because there's kind of heart-shaped uteruses and ones that have partial what we call septum, like little dividing walls and things like that. And people, it's not that uncommon to have a duplicate set of your uteruses.
A duplicate set.
Yeah. So I know I've seen it before
I'm sorry, I
clinically.
am just not often speechless.
I have seen it, I would say 5 times in my career.
Holy crap.
Yeah, and I look at a lot of cervixes, a lot of uteruses. Um, but the human body is amazing. It's there's always something with it. So
Apparently.
that's kind of the rundown of causes, and the causes looking at this are multifactorial, and that makes me think that there's never going to be one answer for it. There's always going to be, well, we could look at it this way, we could look at it this way, and I think in general problems in medicine that are like that have delays in diagnoses.
Okay.
Also, pain in women has a delay in diagnosis,
Because it's all in our head.
of course.
Well, if it's endometriosis
Yeah,
stuff growing in your head, then it is in your head.
right. Hysteria. It's really hysteria.
They
Um,
had a treatment for that back in the 1800s. Maybe we should bring that
yeah, we
back.
could bring that back. So symptoms are pain, definitely pain, and fertility issues. So two really hard problems to cope with in people's lives. I mean, it's not like it's a like, oh, that's what that is. No big deal. Moving on. These are things that trip people up and don't have good answers a lot of time. So if what's the average Delnert woman to do if she's having pain and suspects this might be what she's having? She could, I think, expect to go into her provider's office with a little menstrual chart. That would be super helpful. And if she's having spotting, or is the pain only with her menses, or is it in the middle, or anyway, with as much information as she can give the provider. And she should expect to get tested for STIs, which is reasonable.
That is.
Yeah. What's the most common symptom of chlamydia in this county? No symptom. So she needs to be tested for STIs. Um, she probably should have an exam, although everybody tries to get out of the exam
Yeah,
part.
I don't
I,
blame him there.
yeah, totally get that. But sometimes you have to be expected to let us examine the part of your body that's given the problem.
I'd rather
And
step on the scale.
and then probably likely they're going to have an ultrasound, and pelvic ultrasound doesn't really find endometriosis. They can have some signs, and sometimes they find things like endometriomas, which are or chocolate cysts, which are actual fluid-filled sacs that are filled up with this tissue or the byproducts of this tissue. But that's not really how it's found most of the time. Most of the time, it takes direct visualization of the tissue during a surgical procedure called a laparoscopy. And that's where they make the 5 little cuts, and they just look around and see what they see.
Okay.
So it used to be that they didn't have the 5 little cuts, that they actually had to make a major pelvic surgical incision, and people were loath to do that because there's a lot of recuperation for something like that.
So that's just basically exploratory surgery kind of a thing.
Yeah.
Okay.
So, but now we have the laparoscopy, which has turned out to make things much more minimally invasive. So
Okay.
that's good.
Is there a big recovery time from that?
Not really. And in my experience, I had a lap chole, so my gallbladder out through the laparoscopic procedure, and I was up and seeing patients in a day and a half.
As I say, I went to work the next day. I drove myself home from the hospital and went right back to work. So
Yeah, it's not really a big deal.
it's uncomfortable, but you're right, it's not a big deal.
Yeah. So treatment is dependent on a couple of things. One is if there's no fertility, it pretty much goes along 2 pathways. If fertility is an issue, if there's no fertility issue. If there's no fertility issue, then nonsteroidal anti-inflammatories are recommended, and those are drugs like naproxen, which is called Aleve over the
Okay.
counter, and ibuprofen, which is called either Motrin or Advil. These drugs were initially developed for pelvic pain in women. So
Wow.
this was, I know, this blew my mind. So I learned this when I was in school about 50 years ago that ibuprofen was first developed for painful periods.
To take care of the inflammation in the.
Right. And it is really good at
Okay.
solving that problem. But patients are kind of over that always being the answer and they're a little disappointed. But I would counsel you that if your provider is telling you that this is a good drug to take, then listen to them because that's the whole reason it exists, actually.
What about things like Pamprin and things like that have the ibuprofen, Tylenol, and caffeine in them?
Is there aspirin and Pamprin?
I
Right.
think is it aspirin or is it Tylenol?
I thought it was aspirin, but I might be thinking of an earlier formulation. I don't think that's as good as just Ibuse and probably more expensive, actually. So
Okay.
another treatment, oftentimes, if fertility is not an issue, is combined oral contraceptives. And remember, we talked about contraception last time. There's probably 100 different birth control pills. So if your mom got moody on one, doesn't mean that you're going to have that same
Okay.
reaction to perhaps another one. So with birth control pills, there's where you start and then there's problem solvers, and so they put you in a problem solver combined oral contraceptive as treatment if fertility isn't an issue. And then there's a local longtime gynecologist in Humboldt County who puts a lot of people on Depo, so progesterone only methods. And what that does is the intent is to just shut down periods.
Okay.
So if you shut down periods, which is safe to do, okay, there's always somebody's grandmother who's going to predict, some terrible thing happening. But it's safe to chemically stop a period, and that stops the pain for a lot of people. Not 100% of it, but a majority of it.
Okay.
So Depo-Provera is an example of that. Probably Nexplanon is an example. Probably Mirena, which is a progesterone only IUD. And then there's something that I've never had experience or even seen, but gonadotropin releasing hormone antagonists. Don't even I don't even think I can describe what they are. They're not.
Wait, say that again.
They're gonadotropin, so affecting the gonads, releasing hormone antagonists. So it stops the gonads from releasing a hormone, is what that means.
Okay.
So in this case, ovaries. So I think that's another way of shutting down periods. It's probably super expensive, and I don't recall ever seeing anybody on it.
Would that be like a Lupron shot where you just stop everything?
Yeah, it could be. And
Okay.
I see very few women on Lupron.
Okay. What would be the difference that you would go that route? Is that because it's a severe case and they've seen it?
I think it's better. Yeah, that's probably part of it, but I think it could be better insurance, quite frankly. I think there's some money difference
So
there.
that's why you started this by saying if you're a rich person, if you're a rich woman, this is what you would do.
I don't have enough experience to say that for sure, but I'm highly skeptical. So,
Okay.
and I think for prior authorization, you'd probably have to go through these other treatments and have to demonstrate that they're not working
Okay.
before insurance would pay for something more expensive.
Wow.
So delayed and definitive treatment, if that's what it takes to get you better.
Deny, defend, oppose.
Yeah, exactly.
Wow.
And then surgical ablation, which is you just get rid of the anatomy. So you go in there with what's called a Bovie, probably, which is a little electrical current, and you just zap all the little endometrial spots you see, because oftentimes you can see them
Okay.
visually, or hysterectomy. So there's a lot of older women kind of in our age group who, if you ask whether they have a uterus or not, they'll say they had it taken out because they had endometriosis. And so
Wow.
that used to be just about it.
That was the treatment.
Was- So but a lot of women really want their fertility because remember, this happens in women who are of reproductive age. So what you do then is you kind of speed up the woman's ability to get pregnant so she can get her childbearing out of the way and then go for a hyster. And so those medications focus on ovulation induction. So that means it kind of pushes the ovaries to produce a lot of eggs. And this is where you get stuff like in vitro fertilization.
Okay.
Sometimes they'll do therapeutic laparoscopy where they take that little bovie and they just go in and zap a couple around the fallopian tubes and hopefully they clear the path long enough that the woman can get pregnant when after her ovaries have been artificially kind of juiced up.
Does that have any risk for miscarriages if you do become pregnant doing
Yeah,
this?
there's risk. I see a risk for ectopic pregnancy,
Okay.
which could, those sometimes are fatal when women don't get the reproductive health care that they need. And ectopic pregnancy is never going to be a viable pregnancy. It's just it could go to killing the mom.
So
So,
despite what men say in political circles about just putting the baby back in there,
yeah,
that doesn't work.
it's not a thing.
Not a thing.
Yeah, not even close. So, but and then also you can control pain with NSAIDs here, and that may or may not be helpful for a woman who really wants to conceive and is having this
And what
problem.
do you mean by NSAIDs? Just for,
Non-steroidal
okay.
anti-inflammatories, that's use in that person. So that's the end of the notes I have on it. It kind of a difficult. I see delays in diagnosis. I see not great treatments, and I see kind of problems that medicine might have in ensuring that the woman maintains her reproductive capacity if that's what she wants.
Okay.
So, and we do have physicians here locally. Um, there's gynecologists that can treat this and diagnose this, and there's also a lot of them in, of course, Medford and Humboldt County.
Okay.
So we're kind of lucky with this, but as women, we need to know how to ask the right questions so we don't get written off.
So the fact that that could happen to a young girl as well that have the same issues.
Right.
Like, how do you, as a mother, do you address that with the doctor? Like, hey, this is a history of my family. This is, I think, might
I
be an issue.
in
Can
my
you,
exam room, you just ask. And
in
I
your exam room?
Yeah, I pull out. So on my phone, I have a medical library, and I oftentimes say, "Let me step into the medical library for a minute." And it's not like I'm texting, my best friend. It's like, I'm trying to find these things out, and that information does not. It takes seconds.
Okay. So you're gonna be like Mary Poppins stepping into the picture and going into the medical library and let us know.
Yeah. And
Nice.
I poke my head out and go, "Hey, this is what this says." I don't always believe that one source, and sometimes there's other ways. There's other medical libraries, but this one is kind of the speedy one.
Okay.
So I know we don't have much time left, but I really want to address that Representative Huffman is coming to town for a town hall.
That is right. He's be at the Talawa Event Center, correct?
Yeah, super exciting to hear that. And I would ask him specifically because I've been thinking about raise my hand, go up to the mic. What should I ask? What does this community need to know? I think I would ask him what's going to happen, in his opinion, to our community clinics and hospitals, because I think both are at risk. Um, and I would like to hear like a clear answer from him. What's being done to protect them? Maybe on a state level, which he might not be privy to everything, but I think he knows more than I do. And also, what are they doing as far as preventing it from even happening? And if we ever get to a point where the government supports people's need for healthcare, what are they thinking about creating in the future? Because, the upside of all this doom and gloom, I think, is vision for the future. I want to know his. How's he going to help us out here for healthcare? Because we don't have a lot. And what's he going to do specifically? and what does he know is happening for continued access specifically to reproductive health care? And I would ask both about contraception and abortion. I think that's important for him to give us some idea of what his thoughts are on that and how he would lead us to reestablishing, in the case of abortion, reestablishing our right to care. So, and then can you give us some kind of hope that things will get better? So I I think that the local community clinics, and I'm not administrative and I don't sit in on those meetings, but there's definitely alarm for the direction we're heading.
Yeah. And you think that's valid. You don't think that's just scare tactics. You think those big cuts are going to affect us all when they make the
I
states make up the difference for SNAP and all those other things.
and I'm wondering how much California is able or willing to step in and kind of help with that. So
So if the states have to step in with medical, and the states have to step in with food
right,
food stamps, essentially, which is what the
right,
SNAP program is.
right.
I mean, what about not just California, but the states that aren't net contributors to the economies?
Yeah,
What's going to happen to our neighbors in Alabama and Mississippi and Georgia and Texas? And actually,
absolutely.
Texas is a net contributor. They just don't have their people. Um,
Yeah. Yeah, what's going to happen next? What's the next step? What's his vision? So,
those are good questions.
yeah. Okay. And then I was also thinking about what else we could talk about, and maybe we can talk about that next week because it will be talking on a Sunday and he'll be here on Saturday. So,
Absolutely.
yeah. And before we went on the air today, we were talking about chronic pain, and I have spoken to chronic pain on the show before, and I'd be glad to. I mean, it's an evolving subject. All of medicine is. I'd
Yeah.
be glad to address that.
I think that'd be good. I think it would be good too. I mean, your questions with that you had for Congressman Huffman, talking about that next Sunday is great. But also understanding the difference between what a medical abortion is, the definition, what the legal definition is, and what society's definition is.
Right.
Because it's my understanding that if you have an ectopic pregnancy and you remove the fetal tissue, that's an abortion, and you have to do that to save the woman's life. She needs immediate medical care,
Right.
and that's that's what an abortion is medically.
Right.
Um, Society says that's a miscarriage. So when we write laws that just blanketly ban abortion, you're banning the care for a woman who's had a miscarriage
Right.
to stay alive.
Yeah. Obviously, the laws are written by people that don't have any idea what they're talking about. Yeah.
Yeah.
Women's bodies order medicine. Yes, I could address that easily.
Yeah,
No problem.
there's a huge disconnect, and you can't have intelligent conversations with somebody who believes that abortion is wrong. And what they're talking about is an elective abortion because you found out you were pregnant and you don't want to be.
Right.
And so therefore you terminate your pregnancy and leave no space for the fact that
There's
there's
huge gray zones.
right, there's a medical definition,
Right.
right? Like we have name brands for drugs, but there's a chemical
Right.
name
Generic
for
name.
that. There's a
Yeah.
generic name for it that we
Hmm.
have. And you can't just arbitrarily say we're going to ban this
Right.
without understanding the nuances of what it means medically, what it means legally, and then what we as society have decided to call it for political reasons to drum up vote and scare people.
Right.
So yeah, that's my 2 cents on that.
Okay. We'll talk more.
And I like your idea about the pain management thing too.
Yeah.
This is Health Matters with Lynn Szabo. I appreciate you being here. This is amazing, and I look forward to the conversations we get to have in the future. Thank you.
Thanks.